This is your host, Preetpal, and today we have a very special guest. Her name is Dr. Shilpa Pandey. She's joining us from Orlando. Dr. Shilpa, why don't you take a few seconds and introduce yourself to the audience?
Hi, thank you for having me. Yes, my name is Shilpa Pandey. I am a pediatric pulmonary and sleep doctor. I have my private practice in Orlando, Florida. I'm also boarded in general pediatrics and obesity medicine.
Wow. So that's a very checkered uh, resume. So, Dr. Shilpa, tell us what piqued your interest in sleep? What sleep got to do with all of this?
Well, sleep definitely affects our health overall. And when I was practicing in general pediatrics and pediatric pulmonary, felt that there was a shortage, a need for sleep, and so I went back to fellowship and trained in obesity and sleep, and now I see pediatric patients and adults for sleep issues because I think that's rampant and it's affecting a lot of people.
Wow. So let's start from the very beginning. Uh, is sleep the most underrated phenomenon? Is it the most uh, least understood phenomenon? Is it the most neglected phenomenon by human beings?
On the contrary, I think everyone is always complaining about their sleep or thinking about their sleep. But I think that they just don't have the right ideas about what sleep should be. Um, Meaning that on all dinner conversations, on all friend conversations, people are always commenting underhand like, "Oh, I didn't sleep very well last night. I was worried about my lecture coming up or my talk coming up, or maybe I didn't sleep very night. I'm very excited about I'm getting married, and I just don't have the time. I have so much to do. I don't have the time." And so the first thing when we're busy, the first thing that people tend to cut off is sleep because it's like I'm so busy. I have so much to do. I can sleep 4 hours less and get more done, and that catches up to you, and then it becomes this cycle. And yeah, so I think sleep is really important. It's very easily sacrificed, and then it definitely takes a toll on you.
Right. I think as a subject who has the same sort of perspective or attitude about sleep which you just described, I wanted to ask you that we know very little about sleep. Unlike the amount of research we do on macros and micronutrients which go into human body and heart rate zones when you're exercising, and how it is important to be in zone 2 when you're working out to lose fat and this and that. We don't talk like that about sleep at all, right? We don't try to educate ourselves at that lower level about the science of sleep.
Yes, yes. And I think that is one of the reasons why I chose to become a specialist in it, because you're right, sleep has not taken the stage for a while, and it's about time that it did. It is starting to come out. Many different societies are recognizing sleep as affecting different health. Like recently, American College of Obstetrics and Gynecology recognized that sleep should be evaluated in pregnant um, ladies because it does affect their pregnancy and the health of the baby. And then also cardiology, they came out with new guidelines where patients who have heart failure or high blood pressure should be looking into, we should be evaluating their sleep. And diabetes, definitely, that is one thing that is known. Weight loss and diabetes, sleep should be evaluated.
So, Dr. Shilpa, that is interesting. Can you describe for the audience what happens when you do not get adequate sleep? And please also take a few seconds to describe what adequate sleep means. Right? Is it about consistency over a period of 365 days, or is it over a week or daily? Or what is it? So please take a moment to describe us that as well.
Okay, so let me start there. Let me start about talking about what is recommended sleep. So there is actually numbers of hours of sleep which have been studied, and we know that children require more sleep than adults. So for adults, we are recommending about 7 to 8 hours of sleep, and studies have shown that sleep which is shorter than that, so somebody who sleeps less than 7 to 8 hours, or somebody who sleeps more than 7 to 8 hours, most people will have health consequences from that too. So sleeping too much is not good. Sleeping too little is not good in a long period of time. There is tables that you can actually search by National Sleep Foundation to tell you exactly how many hours of sleep you need by age. On a ballpark, about a newborn will need about 14 to 17 hours, teenager about 8 to 10, and then, as an adult, 7 to 8. So that's how much sleep we need.
Okay. And what happens if you do not get the sleep?
So it definitely affects our functioning. A lot of restorative things happen in your brain when you're sleeping. And if you're not sleeping enough or not sleeping soundfully, then you start having these health consequences and these different it starts affecting your functioning during the day. For example, you may become more forgetful. You definitely are at increased risk of accidents because you're forgetful or your difficulty focusing. School children may start falling asleep in class. Their academics may start falling, or they may start having and some of them may actually become very hyper because they have something called a second wind. So if they're not sleeping adequately or sleeping on time, they actually become more hyper as they become more tired. And so sometimes they can be misdiagnosed as ADHD or ADD.
Wow. Okay. So, so sleep is, I mean, the way I understood it as well was a sleep is a state of paralysis for sort of the human body below the neck, right? So basically, sleep is divided into four stages, which we talk about, and one of the stage has to do with transfer of memories, right? Long term memories to long term this thing, and so that aka dreaming, right? So when you're dreaming, there's a transfer of something. I'm looking for more information, scientific information from you as to what happens in that sense and how the body below the neck is paralyzed so that you don't take reactionary actions towards doing that. So does all of that get affected when you don't have adequate amount of sleep?
Right. So, yes, we have sleep cycles. I think that's what you're talking about, which are about 90 to 120 minutes. We go through these sleep cycles, a couple of these sleep cycles during a sleep phase, meaning like if you're sleeping one night, you're definitely going through all of these cycles a couple of times during that night. We have non-REM sleep and REM sleep, and the non-REM sleep is divided into three phases, and one and two and three, and then there is the REM stage. The REM stage is what you were pertaining to, which is what we call our dream state. And yes, during our dream state, our motor muscles are, for the most part, most motor muscles, except like for respiratory muscles and some other muscles, are paralyzed. And that's a protective mechanism because we don't want individuals to be acting out their dreams when they are dreaming. That would be not nice. But we don't stay in that stage the whole time. So we have stages, N1, N2, and three, where your motor muscles are not paralyzed, and then in the dream state it is. So
Okay. So my perspective on sleep also is that it cannot be treated like a monolith. It can't be treated like how many hours you slept, right? For example, when I go to bed and I notice my deep sleep is a relatively short number, say 30 minutes of the entire 7 hours, right? I wake up and I ask myself, how did I feel about it? Like how did I do I feel rested? Do I feel satisfied? Do I feel at ease? And often the answer is no, right? So can you also comment on some of the other aspects of sleep as quantity, as length, versus sleep as quality, which is the various broken down aspects of it?
yeah, I think this is becoming a very common observation by most people because they're wearing these smart watches that is claiming to tell you your sleep patterns. And then we have patients coming in saying that, I think there's a problem with me because I slept for 8 hours, but my watch tells me my deep sleep was only one and a half. But as I was saying, we're supposed to go through these different sleep stages, and it depends on which stage your phone is or your app is calling deep stage. It could be M3 or it could be REM. But normally, we are supposed to be in these stages for a certain period of time. So you're only supposed to be in REM for normal between 18 to 23, 25% is what we want to be. We don't want more REM than that. We don't want less REM than that. So I think one of the things that I would say is don't concentrate too much on the numbers which your apps are giving you. These are not FDA approved devices. So it's supposed to give you an idea of how your sleep is going, and but don't like start thinking that there's something pathologic wrong with you because that is showing lower numbers.
Mm.
As far as is it good enough for you, I think a lot of it is how you feel. If you're waking up in the morning after 7 to 8 hours of sleep, regardless of what your phone tells you or your app tells you, if you're not feeling well rested, if you're not feeling like you slept well enough, and that's happening consistently, then I think it's time to see a sleep doctor.
Okay. Um that's very very insightful, because the audience out there relies a lot on these smart apps, the Whoops and the Apple Watches and the Samsung Watches to actually track their sleep, and sleep is becoming almost a very important phenomenon. People are worried about the science behind the sleep, right? Actually, that's very surreal for you to say, Dr. Shilpa, that hey, don't calm down, don't over engineer this thing. While it has a lot of science, it doesn't require that level of treatment. Keep it simple and easy so that you can also understand and not boggle your mind.
Right. I
Okay.
mean, listen to your body. I think listen to your body is what I'm trying to say. If your app is telling you you're getting good enough sleep, but you're waking up feeling tired, or you're feeling like you just can't focus, then you should look into it, regardless of what your app is telling you. But I would say take it into perspective.
So I think for the audience, I would like to know, Dr. Shilpa, is give me three parameters. You say when I wake up, I need to ask myself these three questions, or I need to observe these three things to basically say, did I have a good sleep or did I not have a good sleep?
Yeah, so I'll talk about things which are dangerous. So if you're waking up with headaches, then that's something to be concerned about. You need to see someone for that. You need to see a doctor for that. If you're waking up feeling like you want to throw up, or you're vomiting, or you're feeling nauseous, like you feel like you're going to throw up, then that's something concerning. You need to see someone for that. If you're waking up after adequate hours of sleep, like we talked about, you're an adult and you slept 7 to 8 hours, and you had that consistent sort of schedule for the week, and then you're waking up and still feeling tired, and that's something that's consistent, then you need to see somebody.
Okay. And define tired for us.
So there, yeah, that's very difficult sometimes for people to understand, because there's two things, right? There is fatigue, where you feel like you have body aches and you're just tired, and then there is excessive daytime sleepiness. So you have to really differentiate that, because most sleep disorders will present with sleepiness and not just feeling tired. So if you're feeling tired and I tell you, okay, go and sit down and take a nap, can you take a nap? A lot of people will say, well, I'm feeling really tired, but I'm not sleepy and I can't take a nap right now. I'm just tired. My body is aching. I'm just tired. That's not a sleep problem. That you probably need to still see your doctor and evaluate why you're excessively tired and fatigued. But usually for sleep, you are sleepy. So you wake up in the morning and you don't feel like getting out of bed. You feel like I need to go back to sleep. I feel like I need to sleep more. You're hitting the alarm because you don't feel like you've gotten enough hours of sleep. That's the kind of tiredness I'm talking about. It's used colloquially. People will say I'm tired when they actually mean they're sleepy. So the difference is, are you falling asleep very easily? So if you're doing work but taking naps, or you would want to take a nap, or that's on your mindset, like, oh, this would be so nice if this lecture could just finish 15 minutes earlier and I could just catch a 5 minute cat nap, If that's your constant thought, you need to kind of step back and say, like, okay, why am I feeling this way? Naps are normal for children, but as adults we shouldn't be requiring naps. So if you're having enough adequate hours of sleep at night, you should not be needing naps during the day.
Okay. No, that was very helpful that you explained what tired means, because tired is a very subjective term for a lot of folks.
Yeah. So there
Um,
are actually questionnaires which are generated, which are widely available. So you can Google these. The most well known one is called the Epworth Sleepiness Scale. And it's a bunch of questions that it's like you basically just answer, saying that on a normal day, if you're feeling well, I'll give you some of the examples that are on this questionnaire. And I give this questionnaire to all of my patients at their first visit and all of their follow-up visit to see how sleepy or tired they are. And that's the standardized questionnaire. So that gives us an idea. And if I evaluate this patient with this questionnaire and get a number, and I send this patient to any other doctor, they just look at that number, they know exactly where you stand in that, just like you look at sugar levels. Or
as HbA1c.
so this is the sleepiness scale. So there are multiple sleepiness scales that we do to figure out how sleepy you are and what kind of diagnostic tests we should be doing for you, how worried we should be for you. I think that's a better way of looking at it.
Yeah.
So some question would be like, for example, if you are watching TV on a normal, like you've already gotten enough hours of sleep and you're not sick, and if you're just sitting and watching TV, what's the likelihood that you would doze off? If it's not at all, sometimes, most of the times, or all the time. And so we will scale this. Each of those choices have a number. So not at all is 0 points. Sometimes is 1 point. Most of the time is 2 points, and all the time is 3 points. So this is like a multiple choice, and the patient will answer, when I'm watching TV, I fall asleep all the time. That's a 3. So each of these questions we will ask like that, and then we will get the numbers and we'll total it up. If your total is more than 10, you are excessively sleepy for your age and you need to be evaluated.
Okay. So coming back to the question, what happens when you don't get adequate sleep, right? So, okay, Dr. Shilpa, can you talk about this from is it fair to talk about this from an organ by organ perspective, like what happens to the heart or what happens to the pancreas or what happens to the liver? Like, can we speak about what happens to the digestive system? Can we speak like that, or no, it's not to be evaluated that way?
Yes, I think that you can have symptoms in all of your body organs, but I think the list is just so long that we would be here forever. I think in a nutshell, I would say it does affect all of your body, but the biggest, I think I'll say like one most important thing for every organ. So, for example, for your brain, it's, people will complain. I'll tell you what the complaints are. So, people will complain about brain fog. Like they feel like they're in a fog. They just can't remember things. They can't focus on things. They're not functioning very well. That could be because of you're not sleeping well, right? And then the other thing we talked about for children specifically is hyperactivity. So they're hyperactive. They're just like not listening, temper tantrums, bad behavior. From like school teachers maybe saying bad behavior, difficult to focus, difficult to follow directions, forgetful, poor grades, things like that. So that's for children. And then for adults, it's forgetfulness, higher propensity of accidents and things like that for adults. So, and then excessive sleepiness, falling asleep during conversations, falling asleep while watching TV, falling asleep while doing work, falling asleep in lectures for college students or high school students, or even younger kids falling asleep in school. So things like that. For the heart, yes, we know that it affects your blood pressure. It increases your blood pressure. So hypertension, heart failure is can be caused by obstructive sleep apnea. It increases your risk of heart attacks 5 to 6 times more. So if you have any sleep disorders, specifically obstructive sleep apnea, it increases your risk of diabetes, high blood pressure, high cholesterol, obesity as well. So people who are trying to lose weight, if you are not sleeping well, it's harder for you to lose weight because it affects your hormones.
Okay.
Um,
S-
for
Could you go a little
children,
bit deeper into that particular science?
yeah. So we know that in for weight loss, we want to be on a good schedule, and we have certain hormones that help us lose weight. So we talk about leptin and ghrelin, and this is the ghrelin is what helps you eat, and the satiety, and then leptin is our, I guess it's sort of like insulin for diabetes. Um, and those hormones are, we know that their functioning is affected when we have sleep disorders. So if you're not sleeping adequately, or even if you're not sleeping in good hours, so people who are night shift workers tend to have more health concerns than people who are day shift workers, because of just the hormones are secreted differently. They're more resistant. There's more leptin resistance in people who are night shift workers. Also, if you stay up late, you tend to also not eat very healthy. So if you are, and I think you would account for that, if you are staying up late for a late night movie, you're not going for, you know, eating your broccoli or in the middle of the night for the night snack. You're going for the bag of chips. You're going for the cookies at night, right? And so definitely, if you're staying up late and you have an altered schedule, that'll affect your weight loss journey.
Yeah.
So
As you're speaking, I'm beginning to understand this as there are a lot of like secondary impacts as well, besides the primary impacts on the human endocrinology. But there is the secondary impacts on loss of good executive decision making, which actually gets you
correct.
in trouble, right? So you're unable to, the frontal cortex is unable to get you the right decision, or the whatever the brake pads on human beings are to not self destruct, right? I mean, not allowing you to make bad decisions, right? So that also gets compromised. So this thing manifests in a lot of places, right? Now
Yes.
obviously, doctor, you are a very accomplished professional, and so am I, in the sense that I did my engineering school, and we were for us it was considered heroism to not to go on least amount of sleep, right? We were rewarded. The society would say, yo, you're doing a fantastic job, you only sleep 2 hours a day, and the rest 22 hours you're just working
Working.
hard, 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 hard. um, so anecdotally, I want to share one scenario with you. Like, I got so frustrated while I was in my engineering school that I said, no, and I think I just don't feel like doing it. I don't want to be in this speed competition game, right? And there was a particular subject I was supposed to go and give the exam next day. I actually literally I quit on that subject, in the sense that instead of studying till 4 a.m. in the morning, I actually ended up going to bed at 9. And I still remember, because that's there, I still remember that's the subject I got the most amount of marks. So can you explain what happened there? And I that was such an accidental revelation to me, that you would have exams at say 9 a.m. in the morning. You were supposed to show up for an exam, right? And you would be so much like, can I get one more revision in? Can I get one more revision in? And you would go literally till 5 a.m. and then catch a nap for an hour, and then shower up, eat something, and then show up for the exam.
Yeah.
Versus this, what happened?
I mean, that's a known phenomenon that, there have been studies done on this, that if you don't sleep enough, your cognitive function and your memory is decreased. So that's, I think that's what you're pertaining to, that if you don't sleep enough hours. But the thing is, when you have an exam, this is what our society has taught us, right? This is what is expected of us. That if you have an exam, you should be studying till like 2 in the morning because your exams are coming up, and the first thing to sacrifice is your sleep. And unfortunately, this is the kind of myths that we want to break, that sleep is actually important. You want to be getting more sleep when you're studying for an exam. You want to be making sure that you're getting enough hours of sleep when you're studying for an exam, because everything that you study your brain during sleep, in layman terms, needs to put that all in, memory, and go through it and process it. So your brain needs that downtime to process the information that you're throwing at it, when you're studying for long periods of time. And so I think that's what you're talking about, and I think, and that's a known thing. But it's unfortunate that a lot of students and adults still are doing this cramming, and yeah, it may work. There's a peak maybe in the first time you do it, and then after that, the effects are actually less and less. So it is known, and there's studies that were done on it, and it showed the same information which you were able to see with yourself, which is that if you don't sleep enough hours, then your cognitive function is actually lower.
Okay. I think the same, anecdotally sharing similar stories about, immune system, right? I mean, the immune system is also. Can you speak a little bit more about it, right? I observed certain things about myself that there are these periods of times when sleep is, and somehow I see that correlation into me getting sicker or fluer or whatever because of that.
Yes, yes, definitely. You need to be, again, the your body is sort of under higher stress if you're not sleeping enough. So I think that is what it boils down to. And so if you are in a high stress, if your body is in a high stress state, you are definitely at higher risk of, contracting infections, being sicker, and also like other things that I talked about long term. So acute things happen, yes, and then also long term things happen, like the high blood pressure and the diabetes and the sugar, because it's affecting your sugar metabolism. It's affecting your blood pressures are peaking at night, and so all of that is affected. Um, so one of the things that we recommend for children and adults who are going through, for example, viral illnesses, what do we tell them? We tell them to go rest, go sleep, and that's actually a treatment, because you're trying to get your body to restore and build up the immunity again to fight off this infection and get over it. If you are more stressed and not getting enough hours of sleep, you tend to see that the infection, whatever you're fighting, is longer, it's prolonged. So you get over infections better if you have a good restorative sleep.
Right. So, Dr. Shilpa, obviously, you treat a lot of patients with sleep-related disorders, right? Would you mind sharing some of the more common ones which you have seen in your practice?
Right. I think a large portion of patients are coming in to see me because they're being sent by their other specialists, cardiologists, endocrinologists, weight loss management doctors are having difficulty with reaching their goals. So, if, for example, a patient has diabetes, even though they have changed multiple medications or they have tried different things, they are not getting their ideal sugar control. And that's when the endocrinologist thinks, is there something else which is affecting my control of diabetes? And thank goodness now it is coming up that sleep is something that does. And so I'm getting referrals of patients who need to be evaluated for their sleep. And I'll tell you, 60 to 80% of patients who are diabetic have an underlying sleep disorder. So, and the most common sleep disorder is obstructive sleep apnea. So, once we diagnose the sleep apnea, then we treat the sleep apnea, guess what? Their diabetes gets better. So, so that's for endocrinologists, and then for heart specialists, I'm getting referrals because hypertension is not well controlled, or patient is having coronary artery disease or heart failure, and there is an underlying sleep disorder that is trying to be ruled out. And once we diagnose it and rule it out, then we are improving their cardiac function. Arrhythmias are also another reason. So atrial fibrillation is seen in a lot of patients. It's common, and one of the known reasons for atrial fibrillation is undiagnosed, untreated sleep apnea.
Wow. So seem like the iceberg is truly somewhere else, right? I mean, like the problems emanate from somewhere else versus the this thing.
Yeah, I
Uh,
think that it correlates. Like, I think a lot of patients who have diabetes or who have high blood pressure or who have heart conditions also have the sleep apnea, but the sleep apnea symptoms are very subtle. So you're a little bit sleepy, so, but you don't really focus on that. What you're focusing on is the symptoms for diabetes, the symptoms for heart failure, symptoms for high blood pressure are more problematic. They come to that you definitely get diagnosed much faster with those things, which is good. And then you start treatment. But then the patients that are not doing well with their treatments, those are the ones that are coming in. Now our goal is, of course, to treat all the patients that are diagnosed with these conditions should have a sleep evaluation. But now our goal is to raise awareness, public awareness, that sleep is something that you should be looking at for yourself. And if there's concerns, we should be evaluating sleep because it improves your diagnosis. So if you are pre-diabetic, if you had a sleep disorder and we treated it, maybe you wouldn't become a diabetic. We could, of course, with in addition to all the other stuff that you need to do for diabetes, we want to get a better, diet and exercise and all of that. But sleep is a big portion of it as well. So that's where we are trying to raise public awareness for that.
right. So, Dr. Shilpa, thank you so much for explaining to us what is sleep, the various cycles, etc. So let's talk about where do we start. Firstly, diagnosing for all of this, then the treatment, etc. So my first question is, I know you're a sleep doctor. What is a sleep doctor?
So sleep doctor is somebody who has done training in specifically sleep. There is fellowships that we do. For the sleep fellowship, it's 1 year that we study for just specifically sleep, and then we take an exam. So you have to know that your doctor is sleep boarded, or sleep eligible. So that means that they have taken the training and they're waiting to take the board, or they're sleep boarded. That means they took the board and they passed it. So that's a sleep boarded physician.
And what is a sleep doctor really doing for you? If I were to come in as your patient, what would they do for me? And what am I supposed to be? How am I supposed to be interacting with a sleep doctor?
Right. So, I mean, you can very easy to search for sleep doctors, just like any other specialty. You can Google us and look for a sleep doctor, sleep boarded physician near you. You can call your insurance company and find out who is a sleep boarded physician who is in network for you if you're going through your insurance, and find us that way. And then what are you expecting? You should definitely make an appointment, come in. If you have sleep concerns, we usually start by the first visit is a consult visit, which is very important. So if, unfortunately, this is one thing that I'll say a lot of people are claiming to treat sleep. You should really know who your doctors are, who is treating you, and what is their training. And a lot of companies are just sending you devices at home to get tested, and nobody's really looking at it. Nobody's following up. That's probably not the best plan. You should go to a sleep doctor, sit down one on one, just like you go to your cardiologist. You should go one on one for them to evaluate what is your problem. Maybe it's just a sleep issue because you're having these sleep symptoms because you're not sleeping in adequate hours, but somebody has to evaluate for it and then treat it, and then give you a treatment option and treatment guidelines, guidance accordingly to what your issue is.
And then, Dr. Shilpa, I forgot to ask you. You've been using this word sleep apnea quite a bit. What? Say more on that.
Right. So obstructive sleep apnea is one of the most common sleep diagnoses. It can be in children and in adults, and the most common reason for that is because your airway is collapsing. So if basically when we are sleeping, of course, we talked about this, all of our muscles are more relaxed, and when we're breathing, we need the air to go in and out of our airway. But if the airway is collapsible, then it's hard for the air to pass. And so if this was our airway, like a circle, and the top is kind of collapsing down when we're breathing, if there's partial collapse, it's hard for the air to pass. And that's when we have noisy breathing, which we call snoring. And if there is complete collapse, then there is no air passing, and that's what we call apnea. So if you are stopping to breathe for short periods of times, and we're talking about like short periods, 20 seconds at a time, if you're stopping to breathe during your sleep, and you're having dips in your oxygen, then we count those events, and depending on how many events are happening per hour, we diagnose you with sleep apnea, and then we further break it down into mild, moderate, and severe.
Okay. All right. So Dr. Shilpa, so give us a treatment protocol for sleep apnea. I'm not asking you to treat somebody. I'm just asking you, like, what's the process to follow for, okay, step one, do this, step two, do this, step three, do that for getting the right help.
Okay. I mean, of course, find yourself a sleep doctor first and
Right.
then get the right study ordered. So there are sleep studies that we do, which is basically we are monitoring your sleep for usually one night. Sometimes it can be two, or more, but we usually do a single night sleep study, and then we try to diagnose what is going on with your sleep. So sleep studies can be done in lab, which means that we have sleep labs, and you would come over there. We'll put a multiple leads on you. These are all stickers. There's no needles. We put a lot of stickers on your head and chest. So it's an EEG and an EKG, and there are arm leads and oxygen leads, and it's a very comprehensive study where we're just monitoring your sleep. So you go to sleep, it's not under anesthesia, so we're not giving you any medications to put you to sleep. You just go to sleep naturally, and we are just recording the whole night and seeing what's going on. That's an in-lab study, and then there is also home sleep studies, which can be done now, which can be done in the comfort of your own home. So you can go see a sleep doctor. They can order a home sleep study if you qualify for it, and then they'll set it up for you. You go home, get the sleep study done at home in your own comfortable bed, and then we read it and try to figure out if you have a sleep disorder, and then based on the results we can talk about the treatment options available for you.
So treatment options would include, like, just give us a flavor of what could be all the types of treatment, you know, proposed, right? From basic to more advanced.
Right. So for, as I said, for sleep apnea, we break it down into mild, moderate, and severe, depending on how many events of stopping breathing you're having, how many of these apneas you're having per hour. Up to 5 episodes per hour is actually considered normal. So we all stop breathing a little bit when we go to sleep. And if you're having about 5 episodes of stopping to breathe 20 seconds each episode, and five of those per hour that you're going to sleep, you don't have sleep apnea. But if it's, and you could be snoring during that time too, and that's okay as well. It's more than that. So if it's more than 5 episodes per hour, then you have sleep apnea. So 5 to 15 is mild for an adult, and the criteria for pediatric patients is different. And 15 to 30 is moderate sleep apnea, and greater than 30 is severe. The reason I break it down like that is because the treatment options vary depending on if you have mild sleep apnea, moderate sleep apnea, or severe sleep apnea. So for all of them, actually, the sleep hygiene that we talked about, that's really important. Meaning that you need to be getting enough hours of sleep, because that is going to, if you have sleep apnea, that's obviously already affecting your sleep, and then you're not getting enough hours of sleep. That's a double whammy. That's making it even worse. So that's something which is controllable. You can do that. And then weight loss is very, very big, because we know that if you lose 10 to 15% of your body weight, that makes a dent in your sleep apnea. So if you have, and it's very like intuitive if you think about it. If you are very overweight and you have a whole lot of body weight of fat on your chest and your neck, and you're trying to sleep on your back, this is pushing down on you. Now your airway has to not only work against gravity, it has to push up all of this weight. So the more weight you can lose, you definitely improve your sleep and your sleep apnea. So that's one of the things that I highly, highly recommend for all patients who have sleep apnea. And then moving forward, then there are other treatment options, which are devices that can be used, like CPAP devices or oral mandibular devices that can be used for sleep apnea.
So, Dr. Shilpa, thank you so much for educating the audience here, and we really would want you back. But any closing remarks for the audience?
Um, yes, I think that I would say if you are sleeping too much or not sleeping enough. So I think if you're too sleepy or if you're sleepless, you definitely need to see somebody for that to evaluate. And then I guess it's easy to find the sleep doctor. If you're in Orlando, please reach out to me. I would be happy to take care of you. And don't be afraid to. I think one of the things that I would say is that people are afraid of diagnoses, so they kind of like put it, under the table, like they don't want to get tested because they don't want to know. And so don't be afraid of the sleep doctor, and we're trying to all get you to better health, and I think sleep is a big portion of your overall health. So get evaluated, get screened first, get evaluated if you need it to be, get tested, and then talk about the treatment options which make sense to you. And your sleep doctor should be able to work with you to find an option of treatment which will work for you and improve your overall health.
I thank you so much, Dr. Shilpa, for being with us here. Thank you.
Thank you for having me.